Joining me now to discuss the Vice President's medical report is Dr. Lipi Roy. She's a physician at Greenwich House in New York. Dr. Roy, thank you very much for joining us. You heard Priscilla there ticking off some of the highlights of that medical report. What are your takeaways?
Good to see you, Alex. This is such an important discussion. Look, I think transparency is a key aspect of leadership. The health and well-being of any elected official, particularly that of the leader of the Western world, is relevant to the public. Let me first disclose that I have not personally evaluated either presidential candidate, but I did review the medical report. And as a doctor, I found it very reassuring. The report stated that Vice President Harris is a healthy 59-year-old female whose medical history is really notable for seasonal allergies, hives, or urticaria, which are hives, a benign skin condition, and nearsightedness, for which she uses corrective lenses. She also has no history of chronic conditions like heart disease, lung disease, neurologic disorders, diabetes. Her physical exam, as a former primary care doctor, Alex, her blood pressure is probably better than mine. So all of that for me, it was very reassuring. I mean, I think the only aspect of the report that was missing was a mental status exam, but really there's no compelling reason to perform a full mental status exam on an otherwise healthy individual of the VP's age who appears articulate and cognitively intact. So from that standpoint, I found it a pretty reassuring report, Alex.
And Doctor, in terms of family history, which of course is something that anybody checking out a candidate is going to consider, we know that the Vice President's mother died of colon cancer at age 70. Is that something that is hereditary and could be cause for concern?
Yeah, it's a great question. Interestingly enough, and sadly enough, we are actually seeing an incidence of a rise in colon cancer among younger people, people in their 40s. But so that in and of itself is actually not that concerning. This is coming from somebody who has her own family history, also on my maternal side, of both of my grandparents dying of colon cancer. So this is a topic I take very seriously. If you also read in the report, she's also getting her routine preventive screening, including colonoscopies. So as long as she's getting those routinely, and there's really should be no cause for concern. I will just say that, based on years of just going back to mental status and judgment, based on years of observing VP Harris in interviews and public appearances, I feel that she's somebody who's clearly mentally and cognitively stable. And as a physician and a public citizen, who's, by the way, going to be a first-time voter, I just got my citizenship last year. I want a leader who's physically and mentally strong, who displays empathy and good judgment, especially during a crisis such as COVID. I was in New York City, New York State, which was the global epicenter for COVID. You want a leader who's making sound judgments that are rooted in science and empathy. That's what I think we all need in a leader, Alex.
Yeah, and you noted transparency at the top, and we should just say that we know relatively little about her rival Donald Trump's latest health conditions on a number of fronts. Dr. Lipi Roy, thank you so much for your thoughts today.
Anytime.